Under the calm grey sky of Geneva, the marble headquarters of the United Nations and the International Committee of the Red Cross stood as symbols of urgency.
There are different factors. Yes, security is one, obviously, but that's mostly when trucks will get inside the Gaza Strip. But before that, there are the entry points. And again, to be updated in the next hours, but to my knowledge, not all entry points are open to have humanitarian aid inside Gaza. And that's the main issue right now. And that's what humanitarians, including the ICRC, have been calling for in the last hours, is making sure that because of the huge needs, all entry points can be open.
It was here that diplomats and humanitarians gathered, their voices steady but filled with alarm. The ceasefire in Gaza had entered into force. The guns had fallen silent, at least for now, but the cries for food, water and medicine had not. Across the hall, microphones blinked red as Christian Cardon, the ICRC spokesperson, addressed journalists. His message was firm, measured and deeply human. There are different factors, he said. Yes, security is one, obviously, but the main issue concerns the entry of trucks into the Gaza Strip. Not all entry points are open to allow humanitarian aid inside. That's the main problem right now. His words captured a crisis frozen in bureaucracy and border closures. Despite the ceasefire, aid convoys remained stranded. Thousands of tons of food, medical supplies and fuel waiting at the gates of Rafah, Kerem Shalom and Erez. Inside Gaza, hospitals were collapsing, surgeries being performed by flashlight, doctors pleading for antibiotics, and families boiling contaminated water for survival. In the days following the ceasefire announcement, international attention turned toward the crossings, the narrow arteries that could mean life or death for 2 million people trapped within the Strip. The United Nations had already warned that the humanitarian situation was beyond catastrophic. Electricity remained scarce. Fuel stocks were nearly exhausted. More than 90% of Gaza's population had been displaced, living in overcrowded shelters or makeshift tents among the ruins of their former homes. The UN's humanitarian chief in Geneva called for immediate coordination between all parties. The ceasefire is only the beginning, he said. Humanitarian access must follow immediately, without restriction or delay. His appeal echoed through every newsroom from New York to Cairo. Aid agencies were unified in their demand, open all crossings, now. Behind the scenes, diplomats from Egypt, Qatar and the United States scrambled to negotiate logistics. Egypt's Rafah crossing had reopened under limited supervision, but only a handful of trucks were permitted to pass daily. Israel maintained tight security checks, citing concerns that weapons or dual-use materials might enter Gaza. Meanwhile, the Palestinian Red Crescent described the situation as a race against time. In the small press room of the UN building, Cardon spoke again, this time with quiet frustration. The situation should evolve in the coming hours, he said, but as of now, not all entry points are open. That's what humanitarians, including the ICRC, have been calling for, the opening of all crossings because of the enormous needs. The enormity of those needs cannot be overstated. Gaza's health system, already under severe strain, now functioned at less than 15% capacity. At al-Shifa Hospital, the once bustling medical centre of Gaza City, corridors were filled with patients lying on stretchers and floors. Paediatric wards turned into emergency triage zones. Outside, the smell of dust and fuel mixed with the odour of burned concrete. Doctors Without Borders reported that trauma patients were being operated on without anaesthesia. The World Health Organization described the situation as unprecedented in modern humanitarian response. UNICEF, meanwhile, warned that children were now dying not from airstrikes, but from dehydration and preventable disease. As the world watched, aid trucks piled up in the Sinai Desert, rows of white vehicles marked with red crosses and blue UN emblems, their engines off, their drivers waiting for the green light to move. Each truck carried enough food for hundreds of families. Each delay meant another day of hunger. The Red Cross and UN officials emphasised that humanitarian neutrality must be respected. We are not part of the politics, Cardon explained. We are here to save lives. His statement reflected a growing frustration among aid workers who had spent weeks negotiating access amid shifting ceasefire lines and military restrictions. In the diplomatic corridors of Geneva, the conversation broadened beyond Gaza itself. Officials from the European Union, the Arab League and the African Union joined calls for coordinated humanitarian airlifts. Spain and Norway pledged additional medical support. Switzerland, hosting the meeting, announced an emergency fund to facilitate border operations, but the question remained who would guarantee the safety of aid convoys once they entered the Strip. On the ground, the ICRC's local staff, many of them Palestinians themselves, continued their dangerous work. They cleared roads, repaired water lines, and evacuated the wounded from bombed neighborhoods. "We need access, and we need it now," one field officer told UNTV. "Otherwise, this ceasefire means nothing to the people bleeding in hospitals." The ceasefire, while fragile, had brought a sliver of hope. Yet without aid, that hope risked fading quickly. The UN's World Food Programme warned that famine was imminent unless crossings opened fully within 48 hours. Humanitarian logistics experts described the situation as the most complex in modern memory, combining political blockade, military coordination, and the collapse of civil infrastructure. International reaction was swift. In Washington, President Donald Trump's envoy to the region said the US supported immediate humanitarian facilitation through all available routes. In Brussels, EU Foreign Policy Chief Josep Borrell declared that Europe stood ready to provide logistical and financial backing for large-scale aid convoys. From Doha, Qatari diplomats confirmed coordination with both Egypt and the US to expand the Rafah route. Despite these pledges, progress remained painfully slow. Each crossing was a checkpoint of negotiation, each truck a symbol of red tape. Aid agencies described the pattern as a humanitarian bottleneck, one that could be broken only through collective political will. By evening, Geneva's quiet streets reflected the growing tension. UN press officers moved between rooms, drafting statements and preparing for late-night briefings. The mood was somber but determined. The Red Cross repeated its core message: neutrality, humanity and urgency. "People are dying not because of violence now," Cardon said, "but because we cannot get to them." In the following hours, reports from Gaza filtered in, a trickle of aid trucks entering through Rafah, carrying medical kits, bottled water, and high-energy biscuits. Crowds gathered at the border, cheering as the convoys rolled in, but hundreds more trucks remained stranded outside. Humanitarian officials warned that without the reopening of all crossings, including Kerem Shalom and Erez, the aid flow would remain insufficient to meet Gaza's vast needs. The UN's Office for the Coordination of Humanitarian Affairs estimated that over 1,200 trucks per day were needed to meet minimum relief standards. In contrast, fewer than 150 had entered since the ceasefire began. "This is not aid at scale," one official said. "This is a drop in an ocean of suffering." Inside the United Nations building, discussions continued late into the night. The Humanitarian Coordination Centre displayed maps showing truck routes, storage facilities, and damaged roads. Logistics officers described the need for fuel corridors to power hospitals, bakeries, and desalination plants. Without fuel, they warned, the aid would be meaningless. Trucks could enter Gaza, but the generators, ambulances, and water pumps would stay silent. In the midst of this urgency, Christian Cardon's earlier words echoed across social media and news broadcasts: "All entry points must be opened." The quote became a rallying cry for humanitarian advocates. Editorials in major newspapers called it a moral imperative. Civil society groups in Europe, North America, and the Middle East began organizing solidarity campaigns, demanding that world leaders turn words into action. By dawn, the humanitarian crisis in Gaza had again become the defining moral test of the international order. The ceasefire was fragile, the politics uncertain, but the suffering undeniable. For the ICRC and the UN, the mission was clear: to deliver aid, restore dignity, and remind the world that behind every border and checkpoint stood human lives, waiting, hoping, enduring. As Geneva's flags fluttered in the morning wind, Cardon walked past the journalists, his face weary but resolute. "We can rebuild later," he said softly. "Right now, we need to save lives." And with that, the cameras dimmed. The reporters packed their equipment, and the quiet determination of humanitarian diplomacy carried on. One crossing, one convoy, one life at a time.